Find a golf ball sized mass in that right breast.
So I'm apparently now a Dr. Yoon Stitch account, but a follower tagged me in this and I thought it was another interesting question. And I've actually had a patient that had this exact same thing happen. So I'm going to tell you what I personally would do in this situation, and then I'll tell you what happened to my patient and how I managed her. So in general with breast reductions, the surgeon always does a proper exam and always gets proper imaging. So you really should never miss a tumor of that size. A golf ball sized tumor is a big tumor, and you should be able to feel that on physical exam, even in larger breasts, and you certainly should see it on imaging. So in general, when I've done videos about my personal patients who have had a hidden breast cancer found with breast reduction, they're teeny tiny little microscopic cancers. They're things you can't see or feel. They're not something like this. So say you actually encounter that, there's actually a lot of different options, and it will be a pretty complicated decision tree. So it's really going to depend on where the tumor is. Is it in the tissue you're removing or the tissue that's staying behind? And then also it's going to be important, when do you find it? Do you find it at the beginning of the operation versus the end of the operation? So if it's in the tissue being removed and you find it at the end of the operation, then it's important to orient your specimen. So your specimen is the piece of tissue you remove that you send to the pathologist. Now in a breast reduction, we don't orient that, which means we don't tell the pathologist what is up and down and deep. It's a very complicated, bizarrely shaped thing that we remove. And so if you are concerned this may be a cancer and it was unexpected and you find this at the end, you want to make sure you orient your specimen so you can get accurate margins if it is in fact a cancer. Now, if it is in tissue that is remaining, or you find it at the beginning before you really start your resection, I would probably send a frozen. So a frozen is when you take a sample and you send it to the pathologist and they immediately respond back. Now, frozens are not always accurate and they're not as good as the final pathology specimen, but it would be a good option if you were really concerned. So that's just a quick how you would normally manage this as a plastic surgeon. But again, you really should never find yourself in this position if you do a proper workup and evaluation before surgery. So this is my patient that had this exact same thing happen. So she went to a plastic surgeon other than me and had a breast reduction done on that left side. And they found something they thought looked like a big scary mass, and they finished the reduction on that side and sent it to pathology. The pathology was benign, it was not a cancer. And she was so uncomfortable because of the asymmetry, and she didn't feel like she was able to get the surgeon to schedule her fast enough. I think it was like 18 months in between his surgery and mine. So that's how she ended up becoming my patient. And as you can see, I did a breast reduction on the right side, and I did a little zhuzhing of the left side as well. So she's doing great, she's comfortable, and she had that exact same scenario that Dr. Yoon was discussing. So like lots of things in plastic surgery, there's often not one clear, absolute answer. There's a lot of what ifs, but it's an interesting question. Let me know what you think in the comments.